A specialist psychiatrist at the Accra Psychiatric Hospital, Dr. Na Doleboche, has called on authorities to urge government to move mental health service onto the National Health Insurance Scheme to enable patients access adequate care. She said this at the inauguration of Clubhouse Ghana Rehabilitation Center in Pantang here in Accra. According to the World Health Organization WHO, about 13% of Ghanaians are mentally challenged. At the Accra Psychiatric Hospital, the facility has about 170 well patients abandoned by their relatives. It is against this backdrop that Clubhouse Ghana Rehabilitation Center has welcomed into its facility 22 mentally challenged patients from Pantang Hospital and the Accra Psychiatric Hospital as part of efforts to help address mental health challenges in the country. Clubhouse Ghana, founded by ML Blay-Miezah with her team, are the brain behind the first ever Clubhouse-franchised rehabilitation center in Ghana and also the first in all of West Africa out of all other 340 clubhouses across the globe under Clubhouse International. The facility aims to provide them with critical, intellectual and hands-on training in an environment that is trusting, supportive and impactful. The director for Clubhouse Ghana, Kwakye Boaten, said the facility will further assist patients fully recover in order for them to be self-sufficient.
This model is a bit different from the other models that we know, rehabilitation services that we know. This particular one tries to give the individual that will come here, will try and make sure that you'll be able to be independent on your own. You will be able to have some skills that will earn you some living. Will be able to do some basic things for yourself. So we are saying that you give us a person with mental health conditions, and at the end of this rehab, we are going to make sure that this particular person will come out transformed and well equipped to be able to be independent in the community.
A member of Clubhouse Ghana in charge of psychiatric and social work, Christopher Komla, noted that mental health is indeed critical because it impacts the thoughts, behaviors and emotions of individuals.
What exists currently where you find persons with mental health conditions walking the streets? And so my assessment of the situation is that, yes, for what I have seen, I think we are on the right path. And we pray that that impact will be felt in society.
A specialist psychiatrist at the Accra Psychiatric Hospital, Dr. Na Doleboche, has urged government to move mental health onto the National Health Insurance Scheme to enable such patients to access adequate care. She explained that facilities such as Clubhouse Rehabilitation Center will support government efforts to integrate mental health into the general healthcare delivery system across the country.
Such patients. So in fact, it is quite a burden. Imagine feeding 3 times a day, 170 patients. Even in our own homes, when we have 5-6 people, it's quite a challenge. So the hospital is heavily burdened with well but abandoned patients. That's why we are happy with the Clubhouse facility. We believe that when these people have an employable skill, they can come out, they'll be independent and they'll fend for themselves.